Hello, this is PTA 600 week 4 assignment. So this week we have AG, which is a 17-month-old girl with Down syndrome. And currently she is functioning below her age level in terms of fine motor development and cognitive development. So her biggest concerns with her parents are that she is not walking. So they're wanting this physical therapy to address the motor skills that can get her to that point. She does have a supportive family who is very involved in the infant intervention program. She is pulling to stand and she's creeping on furniture, but again, she's not walking independently. So some of the things that we're going to be addressing in therapy is going to be her delayed gross fine motor development. She does have hypotonia, she has hypermobile joints, she is dependent in ambulation, and she has delayed postural reactions. One concern in therapy that we want to be extra careful and cautious of is that she does have, she runs the risk of having atlantoaxial instability, which is more common with these children with Down syndrome, and this condition can put the spinal cord at risk during certain movements. So we want to be really careful with hyperextension or rough play, or aggressive range of motion. We want to make sure that we're not overly stretching because she does have the hypermobile joints. Any activities we want to avoid that place the stress on the upper cervical spine unless it's cleared by a physician. So contextual factors in this case, like I said, in her personal factor, she's very cheerful. Her parents said that she loves to sing, so she's a very happy baby. She has interest in interacting with her environment, which is a great strength for her to stay engaged during our therapy sessions. She has a loving and stable home, so those environmental contextual factors are positive. And psychosocial, just the mother is expressing that concern with AG's walking timeline, so we're just going to help continue to support them and to educate them on what the proper timeline of her age group should be doing and how we can help progress her to meet those motor milestones. There is no barriers in terms of income or transportation or access to care. As I mentioned, she does have a very supportive family who is very concerned with her motor development. One strategy that we can use in therapy to enhance the patient's outcomes is to use these play-based therapy activities that we're doing in rehab that can be easily practiced at home. So we want to keep the family engaged during all sessions so that way they know what to do at home and how they can encourage these therapy sessions and encourage them to be used in the home. So like the sitting to standing, using the furniture at home, like a low couch, or just motivating AG to do these therapy at home with her favorite toy and place it just a little bit out of reach and encourage her to reach for them. These are just simple things that they can do that makes it really functional, and it reinforces the learning that we're doing in our session, and it does not take any financial burden or time constraints that can occur in the home. It could be quick. Resources that can be used is going to be the early intervention developmental chart. This helps the therapist to match the activities of learning and developmental level at this age and compare the norms. The Peabody development motor skills can also help the therapist to understand age appropriate milestones at this age, and just information that you can share and collaborate with the speech therapist and the occupational therapist that can help just a collaborative approach to AG's overall therapy.